I'm not certain if you all heard that. Give us just a few more moments. We're giving President Young a moment to log in.
Good evening, everybody, and welcome to our second episode of COVID Conversations Explaining Omicron. Because we have a great deal of great information for you tonight and we want to be able to get to your questions, I won't spend a great deal of time on introductions. And as well, you know our esteemed panel guests. So with us, we have our beloved 13th President, Dr. Licia Crumpton-Young. Welcome thank you for joining us this evening. And we have Dean Rashid Mosavin of the College of Pharmacy and Health Sciences. And of course, our beloved COVID czar, Ms. Zuri Dale, and our campus epidemiologist and director for the COVID Prevention Center. So without further ado, we're going to jump right in. And I am going to start with asking Ms. Dale a question. Please share with us some up-to-date information on Omicron. How severe is it, and why does this variant seem to be more transmissible?
Okay. Much of the information that we have about Omicron right now is coming out of South Africa and in some parts of Europe. South Africa can be credited with a lot of the research, a lot of the groundbreaking research that occurred. And so on an hourly basis, we're receiving updates, but it's very clear based upon data from those parts of the world that Omicron is able to spread quite effectively. And that's both in areas where the Delta strain was the dominant variant and in areas where COVID was not as prevalent. In Europe, for example, where the Delta was already established, it does seem that the virus is able to transmit well among individuals. And even in South Africa, where COVID was not as prevalent, we're seeing the same thing. In comparison to the Delta variant, we do know now that the Omicron variant is a bit more transmissible than the Delta. In fact, preliminary research is showing that the Omicron variant is about 3 times greater, 3 times more transmissible than the previous strain. We also are looking at some research that has been done regarding vaccines and the impact of vaccines on the Omicron variant. And it does seem that part of this transmissibility is majorly due in part to the Omicron variant being able to evade some of the vaccine-induced immunity, and as well as some of the natural immunity that we get just from any viral infection. What we are still collecting data on, and that's both in the world and at TSU, in fact, is data on severity. That data quite often lags infection data. What we are seeing now, though, preliminarily, is that it does seem as though the Omicron is not as severe. Patients who are hospitalized are not, they're seeming to not need oxygen. Individuals who are hospitalized are spending less time in the hospitals. So we've moved from positive case metrics to what does this variant look like as far as severity, transmissibility, and the neutralizing ability of the vaccine. So that's pretty much where we are.
Thank you so much. Dean Mosavin, can you talk to us about the vaccine? A lot of us have been vaccinated and some of us have even gone on to get our boosters, but it seems that we're still able to catch Omicron. Can you talk to us a little bit about that?
Sure, I'll be happy to. You can hear me okay? First of all,
Yes,
thank
sir.
you. Thank you, Madam President, Ms. Johnson, Ms. Dale, the audience, students, thank you for having me on. Absolutely. So vaccines, and we have many of them. COVID-19 vaccine is not really, as far as vaccination, it's nothing new, right? There are many types of vaccines that we use, and we begin vaccinating in childhood. Actually, is so when you think about that, by definition, what vaccines do, they're not going to 100% prevent you from getting a disease, right? They are going to prevent severe disease, hospitalization, and death. That's the actual definition. True for any vaccine. So now, unfortunately, we will keep having new variants, as you know, with COVID-19. And part of the problem with that is we allow the virus to replicate, because if everybody was vaccinated, and if we could have less number of people being positive, we would get less chance to the virus to replicate and therefore create new variants. But in general, again, and I've said this probably 1,000 times this past year, The only way out of this pandemic is vaccination. And again, the idea is you stimulate your immune response to the real virus, but your immune response goes down over time a little bit, and that's why you get a second shot, and that's why you get a booster to bring your immune response back up. But again, the breakthrough infections are common, but as we all know, once you're fully vaccinated, the chances of you, even if you get a breakthrough infection with Omicron or other variants, you will not have severe symptoms. Chance of that very unlikely. You will have very mild symptoms for only a few days.
Cynthia, if I will also want to make a note that one of the most robust studies that have been done so far is this study that was based out of South Africa. That study was based on about 78,000 cases. And while that study did find that the strain was less severe, it also found that 2 doses of the Pfizer vaccination would provide about 70% protection against severe complications from COVID with this particular variant, and about 33% protection against COVID infection. So while we can expect infection even among the unvaccinated, it is still very clear that the vaccine has neutralizing capability. And what the data is also showing right now is that a third dosage is providing even more neutralizing ability than just a 2-dose series.
Thank you so much for that. Ms. Zuri, you and the COVID Prevention Center have done a lot of work on the surveillance and contact tracing of our cases here on campus. Through that tracing, what have you all found to be the most common ways in which individuals are exposing others or contracting COVID?
This is a really great question because I think this is one where it's easy to make assumptions about how viruses spread and where we can expect spread and what we can expect to be super spreader or outbreak events. Quite surprisingly, the majority of the contact tracing that we've done have been linked to a lot of, I would say, personal events, gatherings with families, gathering with friends, gathering with individuals that you know, in comparison to gatherings among individuals that you do not know. So, for example, we actually did not see an influx of cases with graduation, whereas we did see an influx of cases over the holiday break, Thanksgiving and Christmas break. So pretty consistently, what it seems as if we have gotten a bit more relaxed. People are more likely to participate in close social events. I think that because vaccinations provided us a level of protection against the Delta, individuals have kind of gotten out or forgot about the COVID culture. But it's important for us to know that this particular variant that we're dealing with is able to evade those vaccinations a lot more. So while it's able to protect us from disease severity, not necessarily so much with infection. But to answer your question, what we're seeing is a lot of personal events, a lot of hanging with friends, a lot of family events.
And I'm going to stick with you for just a little bit. As we begin this spring semester, can you talk to us a little bit about the measures put into place to keep our campus safe? For instance, what if someone in campus housing tests positive? How will we manage that?
So our COVID prevention response is pretty robust, and it's gotten even more robust as we've continued throughout the first semester. And I'm actually quite proud of this because we did a really great job of mitigating COVID on our campus last semester. We would go weeks with a positivity rate of less than 1%, but we continue to build our capacity for moments such as this. So I want to go ahead and point out that we've continued to build and enhance our capacity through COVID prevention. We do have, not only do we have our clinical testing sites, we have our own lab on campus. We do air quality testing. We do have faculty that do water quality testing. We do sequence our results. But what we have here is a And this is something that we have not been able to see anywhere else. But we have our own contact tracing unit. And so if an individual tests positive, we're able to case manage and monitor and contact trace in order to collect any contacts that we have. We do work really closely with residential life and housing to provide meal delivery, to provide services to students in the event that they do test positive. So we have a ton on our campus to support students to ensure that even if they are not in class physically, they are able to still participate, even if that's virtually.
Thank you for that. Dean Mosavin, what more can we do besides wear a mask to help slow the spread of COVID?
Well, the first thing we all need to do is get vaccinated. We're going to go on the order of effectiveness. We all need to get vaccinated. Next, we all need to wear a mask. Mask wearing is very minor inconvenience as far as I'm concerned. So it should not be blown into some type of a political rhetoric. So vaccination, then you wear a mask. Certainly, as you know, making sure that you frequently wash your hands as you go through the day. And also, as we've talked over this past 2 years almost, social distancing. Just be aware of your environment and where you are, and if you're indoors, and so on and so forth. But again, the key is, other than wearing a mask, is vaccination is real key, and the other two mitigating strategies are also appropriate.
We know that the CDC has recently updated their guidelines as far as isolation when it comes to a positive or exposure case. What is the campus policy going to be going forward?
As of right now, we have not moved towards a 5-day isolation period campus-wide. We are continuing to collect data on that. And because it's crucial that we make sure all decisions that we make are culturally responsive to the demographic that we serve. We are continuing to collect data on symptoms, how long on average our population are experiencing symptoms, the severity of those symptoms before we make those decisions. We are not in a place yet of having collected enough data to make a determination if it is advisable for us as a campus to move to 5 days. So as of now, as of this moment that we are speaking, we are still on a 10-day isolation period with remote school and work, should you be able to do that. And as those changes come and as we collect more data, we will make sure that everyone is updated on what that looks like for our campus landscape.
Mosavin, let's go ahead and talk a little bit about some of the myths and do a little bit of education while we're here. What is your response to individuals who believe that the vaccine was rushed or has not been studied long enough?
Excellent question, and I'm going to add another question to this. But the technology that is used in the Moderna vaccine and in the Pfizer vaccine, the mRNA technology, is nothing new. So most people, they don't realize, they obviously not in the field that we're in. The technology that we use for this particular formulation of this vaccine has been around, and we scientists, molecular biologists, and biochemists have worked on this from Harvard to Stanford to, I can name a few folks at MIT. So the technology was already there. Dr. Jennifer Doudna actually won a Nobel Prize in 2020 for a technology that is very similar, and some of it actually developed in her lab. So once we had the technology already, and when COVID pandemic started, it was a perfect time to use this tech, and this technology, by the way, will continue to be used to formulate other vaccines for other diseases. And the fact that you use the mRNA technology, in fact, your body becomes the so-called manufacturing factory to turn your immune system and create memory, instead of we trying to create the protein from the mRNA. So the again, most people don't realize that we were right at the edge of perfecting this technology as the pandemic happened. So if you think that it was rushed, you were simply misinformed. It was not rushed. But let me also, I was on KTSU the other day, and a caller asked me, well, the reason I'm hesitant is because I don't know what's in it. What's in the injection? And the answer to that is the general public may not know. But when Pfizer or any other company goes to get approval, whether it's emergency use authorization or whether it's full approval of a medication, let's call vaccines medicines, the typical documentation that goes to FDA is somewhere between 50 to 100,000 pages. Every detail is described. Every ingredient in that injection is described. The instruments by which these ingredients are mixed in are described. The sterile rooms where the product is made have to be described in absolute detail. So yes, the general public may not know exactly what are the ingredients, but we know exactly what people get injected with. FDA knows all the specific details. So again, that's also misinformation if we just think that, oh, I just don't know what's in it. That is not true.
I also want to point out and to add to what the dean is saying right now. He mentioned that the technology that was used in order to produce this vaccine has been just in development for a number of years. But what's also crucial about this particular virus in comparison to others that have been extensively studied is the transmissibility of the virus. Because COVID-19, or the virus that causes COVID-19, was so widespread in comparison to other vaccines in their development, there really was no need to wait until people develop the virus in order for this research to occur. It was not hard to engage study volunteers because the virus was already so contagious and widespread. So that's first. And I think that we also need to be able to understand that there's a difference between rushed and funded. Overwhelmingly, vaccine development for the virus that causes COVID-19 was heavily funded in comparison to pharmaceutical companies who have to wait years and years in order to get funding. So not only was the virus funded, but it was widely distributed. And so a really big myth is that their steps were skipped in the development of the vaccine, when in fact steps weren't skipped, but they were overlapped on an overlapping schedule. And I also want to make a note that more study volunteers were recruited for the development of the vaccines than even the MMR vaccine. If you take a look at vaccine history, which is something that people really don't readily do, and it's fine, is that there were way more study participants in these studies than in very common vaccines that we take anyway. So I want to kind of point that out. And I also want to make a quick note is that the effectiveness of the vaccines for the virus that causes COVID-19, it actually has a higher efficacy rate than even the flu vaccine. And so if you really look at vaccine development, the studies that were done on these vaccines were in many cases much more robust than some of the common vaccines that we take.
I think that was some very helpful information. Thank you for that explanation. Ms. Zuri, can you talk about some of the campus data and how that is guiding the decision making?
Perfect. I think this is a question that we get asked all the time, and so I do manage our testing efforts and so in the lab and surveillance, but a very important part of my job is data mining and daily managing our data. And so just to share a little bit with you from last semester, in complete transparency, when we came back from at the onset of the school year, our numbers were higher, and about for, I would say, 2 weeks or so, we dealt with numbers that were a bit higher than the World Health Organization recommendation. Very quickly, we mitigated those numbers, and from September until November, our positivity rates were less than 1%. We left for Thanksgiving break, and our low numbers persisted throughout the time that we were here in November. And what we are seeing now with an increase in cases is what it mimics the world at this point. This is not a TSU thing. This is not, a Houston thing. What we are seeing now, it's quite honestly what we are seeing everywhere. And quite comparatively, our numbers are still overwhelmingly lower than what the city data says. Now, I know that it is extremely easy to say, well, the city of Houston has gone into red and Harris County is red. But you also have to put those values into context. And so you have to look at the exact indicators that are being utilized in order to determine those threat levels. Positivity rates and positivity cases is actually a secondary indicator. That is not the primary indicator that is currently being used. In fact, hospitalization rates and the number of ICU beds is the current metric that is being used to drive those numbers and to drive those threat levels that you see. Now at TSU, that's not a factor for us. That's not a variable for us. So what we have done is we've created our own campus threat levels. So while you may see that Harris County is in the red, TSU in fact is not. Our cases are still extremely low. Comparatively, overwhelmingly, are individuals who have tested positive or asymptomatic, and on average, they are tested negative at day 7. So while the county might look a certain way, it's important for us to look at the sample that we are most concerned about, which is TSU and its constituents. And what we are seeing on TSU's campus does not mimic what we are seeing in the city. And that is predominantly because we are a bit more localized. We did a lot last semester to make sure that we put mitigation strategies and protocols in place. And I think what also is not represented in that data that you see with the county is the overwhelming number of vaccinated individuals that we have on this campus. We put out a number of vaccination surveys last semester. We put out 3 iterations of those surveys, and overwhelmingly we are vaccinated. Now, I know that this also includes community numbers, but St. Luke's, when they were our partner, we issued 30,000 vaccines, and we have given, since we've been back, we have issued many, I need to get the exact numbers on that, many of our TSU stakeholders have even received their booster. So when you look at those values, it's crucial that we put those numbers into context. We do also use the availability of isolation beds and quarantine beds as a metric. We are consistently under the threshold that we need in order to consider our isolation beds and quarantine rooms full. So comparatively, we are looking pretty good on TSU's campus. Of course, it can be better, but in comparison to what we are seeing in the city and in comparison to what we are seeing on other campuses, TSU quite honestly is leading in COVID response.
So Zuri, I'm going to go ahead and ask you one of the burning questions that is out there. Why did we make the decision to go online for 1 week? And how is our campus data guiding that future decision?
That's a great question. When we look at the epigenetics of the virus and the life cycle of a virus, quite honestly, if an individual were to get infected over Christmas break and or during New Year's, the expectation is that after about 14 at the maximum 21 days, their viral load is low, and we see that those epi curves begin to decrease. That is what we expect. That is also what the city of Houston expects. So this is not a TSU issue. This is the reason why you will find that even the local school districts have not opted to close. Even if you look at private institutions such as Rice, who have made decisions to be virtual the first week or two before they've made decisions to completely close campus. If we look at the life cycle of virus, what we do not expect is for our cases to continue to look the way they look, even in the city. And so if we want our response to be data-driven and not based off perception, because COVID is a disease of fact, not a disease of perception, we have to allow enough data to come in order to make those decisions. And right now, we do not have the data to support our campus closing. We don't have the data to support that. But as we continue to collect that data, we are adjusting our response as such. And so one of the reasons why we opted to do that for a week was to collect enough data and to see if our modeling mimicked what the city of Houston is projecting.
Mosavin, do you have any additional commentary on our 1 week online academics?
Not really. I think Ms. Dale covered it pretty well. We just you have to, as I was talking to our president the other day, the decisions we make here are data driven and data informed. So we know where we are today. We're online this week, and as Ms. Dale and her colleagues look at the data that we have this week, I'm sure decisions will be made as where we need to be. And again, as Ms. Dale said, it's not a disease of perception. You have to deal with reality and with facts.
Ms. Dale, can you speak to some of the campus services? I know not everybody's aware of what we offer here on campus. Can you make sure that our whole TSU community knows what we offer?
So we do offer testing daily, Monday through Thursday, 8 a.m. to 12 p.m. We do extended hours on Monday. We stay open till 5 to accommodate those who need to test later in the day. We are able to return results in most cases by 12 o'clock. If tested before 12 o'clock, we are able to return results in most cases the same day. I want to point out, though, that this is part of the reason why our cases on campus continue to be where they are. Our testing and containment strategy is unheard of for a PCR-based test. There's nowhere in the city of Houston where you can get a PCR-based test and get a result the same day within the next 4 or 5 hours. Because of that, we've strategically designed our program such that we can immediately contact whoever is positive and request that they not return to campus the next day. And so when we look at mitigation strategies, isolation and containment continues to be a top strategy, and that is where we are leading, and that is an area where we are doing extremely well. And we are going to continue to offer vaccination. We're going to continue to offer vaccination opportunities on our campus throughout the spring, as we did last semester. Our vaccination clinic is open Tuesday and Thursday from 10 a.m. to 6 p.m. on Tuesdays and Thursdays. That's actually open to the community. I see a question that says the data says Houston is code red. The county is code red. So that's not necessarily, that's the county. And when you look at that data, I want to allow you to contextualize that. The city and the county have included their data, and we know that Harris County is massive. So when you see that the county is in code red, you have to contextualize that and understand that that does not necessarily mean that's Houston, that's the county. I do see a question that says the campus testing center only allows you to test. You're not allowed if you have symptoms. That's incorrect. We test anyone who comes to our testing site. I'm not sure if that question is referring to the health center, but our campus COVID testing is separately. It's separate.
Ms. Dale, if I could also add, that's absolutely true. So symptoms or no symptoms, you can be tested. And what you said earlier, I want everybody listening to this talk to pay attention to. What we have here is very unique. When you can have your results the same day within 4 or 5 hours, that makes a huge difference. Because anywhere else in the city or practically in the whole country, you would have to wait 2 to 3 days to figure out if you were positive or not. So the fact that we know this so quickly on the same day, whether you were tested because you were exposed, you thought, or you were symptomatic, that's why Ms. Dale and her colleagues have been able to keep our positivity rate so low. This is a huge piece that I want everybody to understand, that it makes a big difference if you get tested at 11 in the morning and by 4 o'clock, 3 o'clock, you know your results, versus you have to go around and live your life for another 2.5 days to get the results. So that's a huge point that I want to emphasize.
I want to make another point to something that was in the chat that talked about not everyone getting tested at school and how could that be our data. Thank you for that question. We rely on our data that we collect internally and externally. The constant request is that if a person tests positive for the virus that causes COVID-19, that they report it to the hotline. So the data that we have is a combination of individuals who come to our testing site and individuals who have reported to the hotline. If an individual does not report to the hotline, from our perspective, it cannot be included in our data set. When we think about the individual responsibility that we all have, if you know that someone has tested positive for the virus that causes COVID-19, they should report it, because each report helps us to make decisions. If it doesn't get reported, it's difficult for us to include it in our data set, and we're only able to go off of the data as is presented to us. So I do want to make a point about that. We have created a new COVID-19 reporting link in order to make reporting easier. You no longer have to call. And if you visit the TSU COVID site, there is a link to conveniently report. And so I sent it out in an email this week in the COVID info notice that went out, I believe, on Monday, and you will find that reporting link there. So I do encourage you to report and encourage your colleagues to report. So that way we are able to make sure that we have the clearest picture. But right now, the data that we have just does not show. And a lot of that is just majorly due to the high vaccination rates that we have on campus.
And I'd like to address another comment in the chat. Yes, President Young has had to step away. As you well know, she wears a ton of hats, and she had an emergent issue that has had her step away at the moment. So there will be some questions that we will not be able to answer for you, but we will be able to do our best to answer those questions that are in our purview. And I think it's important, Ms. Dale, as we talk about students and their reporting and their fear of absence, can you talk about how the COVID Prevention Center is helping students manage that absence?
Right, that's a good question, because I feel that it's a couple of questions have kind of come up about that, particularly it seems as if there are certain colleges that have gotten brought up. We have spoken with faculty this semester and made them aware of exactly what our process looks like. When a student doesn't report their sickness or their illness to COVID prevention, they do not get the letter of isolation or quarantine. There's no way to give them the letter for them to show to their professors if they don't report it. So part of what we do is collect test results, and we send out notices of isolation or quarantine so faculty know that this is a student that has been verified by COVID prevention. And so that's reporting is crucial for the purposes of contact tracing, but also so that you can get the accommodations that you need. We cannot provide the accommodation if we do not know that the infection occurred. And so one of the first steps is, in fact, letting us know if you test positive. And if there are some negative ramifications or consequences, we can deal with those as they come, but the university policy is that if a person tests positive for the virus, that they are to receive a notice of isolation or quarantine, that they present to their professors in order to receive the appropriate accommodation. That is the university policy. And so I see a lot of comments about a particular department. School has just started, so I challenge you to allow the semester to continue and see what you see this semester. The semester just started today. So if anybody reported today and didn't get a letter, let me know. I can't speak to what happened last semester, but this semester started today. So if you did not get your letter and your accommodations have not yet been made, please email me at zuri.dale@tsu.edu.
Since we are knee deep in a surge of Omicron, Ms. Dale, what does the future look like? Do you think there will be another variant? How do you think the landscape will look going forward?
Well, if we talk about what variants Thank you, Shira. If anybody tested positive last week, please encourage them to report to COVID prevention and we'll get them their letter, okay? All right, so when we think about variants and how variants are able to occur, is that variants arise due to host susceptibility. And so the idea is that by getting vaccinated, we lessen the number of hosts that a virus is able to attach to. So on our cells, we have receptors, and viruses are very specific to the receptors on our cells. And by vaccinating, what we do is we try to create an atmosphere where the virus is not able to infect a host. And so as we continue to see individuals who are not vaccinated, we continue to have more susceptible hosts. It's also important to understand that in just the general viral life cycle, whether this is COVID or the virus that causes the flu or any other virus, is that as long as the virus is able to enter our cells, the virus is going to replicate along with our cells in the cell cycle. So ultimately, we have individuals who are not vaccinated. And because we have individuals who are not vaccinated, we have more susceptible hosts. The virus is just an atmosphere for the virus to continue to replicate. In the state of Texas, our vaccination rate hovers around 55%, which we know is not really high enough for any induced herd immunity. Now, our vaccination rates on campus are higher than that, but in the greater state of Texas, we are about 55%. And so as long as we have individuals that continue to not vaccinate, we are very likely to see an increase in emerging variants. However, I think that the term variant has become a scary term. Variant has become a term where it's like, oh, wow, it's a variant. Variant simply means it's a variation of the original strain that caused COVID-19. It does not mean that it is more detrimental. It does not mean that it is more severe. It just means that it's a variation of the original strain. There have been many variants that the CDC and the World Health Organization continues to monitor. Some of them are more transmissible, and those are the ones that we hear about. But variant simply means that it's new. It's a variation. And just with the way that viruses work, we can expect that as individuals continue not to vaccinate, we are going to continue to see variants, but it does not mean that those variants are going to be more severe. Now, even when we look at Delta and even Omicron, those are variants of concern. So what that means is, we notice some changes, we notice some differences genetically, and those are ones that we're continuing to monitor. But again, like in the case of Omicron, variant does not always mean that it is going to be more severe. But generally, Cynthia, to answer your question, as individuals continue to not vaccinate, we can expect variants to continue to arise. And so was the Delta not more dangerous than Omicron? That's a good question. So what the data is showing now, infection tended to last a little bit longer with the Delta in comparison to Omicron. We also noticed that individuals tended to be more symptomatic for longer with the Delta in comparison to Omicron. Symptoms and infections are a bit milder with the Omicron variant than we saw with the Delta. However, it was more easily able to spread. So even though symptoms seem to be milder, transmissibility went up. So we had severity go down, but transmissibility go up. So we're going to see more people catch it, but not necessarily more people being sick. And so something else that we want to point out, even when we talk about those hospitalization rates, and Nadine and I were having a conversation about this week, there's a difference between hospitalized with COVID and hospitalized because of COVID. And so one thing that the data, the hospitalization rate data doesn't tell us is, did that individual go into the hospital for COVID, or were they in the hospital with something else and they routinely received a COVID test? Because I will say on our campus in particular, we have a lot of individuals who more routinely test. Let's say they're an athlete, or let's say they reside on housing, or they're doing their regular every 2-week test, and they're completely surprised. They're overwhelmingly asymptomatic. They are just taking their test routinely and they're finding out. So even though we include them in our data, the majority of those individuals had no idea at all that they were sick. The question, Ms. Coleman, you're correct. The symptoms with Delta were more likely to land infected patients in the hospital. However, the Omicron strand is now the dominant strain in the United States. So you are correct as it relates to the Delta, but Omicron is also the dominant strain. The other thing I want to make a point of to answer your question, we are able to sequence all of our data, okay? We sequence all of our results. So the day that the Delta arrived on our campus, we knew exactly when it arrived here. So we were able to swiftly mitigate that. The day that Omicron arrived on our campus, we knew, and we were able to swiftly mitigate that. So that's another service that we provide here. It's not public information, but it's something that we do. So if another variant were to emerge, we would know. And right now, even with the cases that we have had, they mimic the greater city response, and the Omicron, which is the less severe strain, is the predominant strain right now in the U.S. And in the city. Thank you so much, Ms. Coleman. If you will, please send me an email at zuri.dale@tsu.edu, and I'll be happy to work with you on what we can do about that.
So again, we're here to share some broad information, and we cannot speak to every individual concern. As Ms. Dale said, you can reach her at zuri.dale@tsu.edu or COVID prevention at TSU, and we will work together to help get some of your concerns addressed. And with that, before I turn it over to Ms. Dale, Dean Mosavin, do you have any closing comments?
No, once again, thank you for having me on. To the previous question you asked, I don't know how many more variants are we going to have. And again, to Ms. Dale's answer, we need to get everybody vaccinated, and eventually the whole globe is going to achieve that herd immunity that she was talking about. Because remember, we can get everybody vaccinated here, but if people in India and South America and parts of Africa are not vaccinated, these variants could still emerge. But eventually we're going to get to a point where a good 75–80% of the people are either vaccinated or they have gotten the disease and survived. So eventually there is a light at the end of the tunnel. And I also want to absolutely emphasize, folks, again, getting the COVID vaccine does not give you the disease. May have some mild symptoms for a day or two, but I want to make sure everybody understands that vaccination does not mean that ever it would actually give you the disease. That is, if you've heard that anywhere, get it out of your mind. It's not true. That's all I have, Ms. Johnson.
Ms. Dale, please go ahead and close us out.
I do want to, President Young actually was having a bit of technical difficulty, so she was unable to log on. But if you will, what I will request is that if you have any questions or burning questions for President Young, if you will, please send them directly to me at zuri.dale@tsu.edu, and I will get those questions answered for you all expeditiously. So if you'll do that for me, I will be more than happy to get those questions answered. Ms. Diaz, you can email me directly, zuri.dale@tsu.edu. Thank you, Ms. Johnson.
Okay. Again, so sorry that we could not answer all of your questions, but we did want to ensure that you had a broad understanding of all of the things that this campus is doing to ensure that you have a safe return for the spring semester. And again, COVID prevention at TSU or zuri.dale@tsu, and we will work hard to get your questions answered. Thank you and have a wonderful evening.